I'm Dr. Rashmi Halker Singh. I'm the Deputy Editor of Headache. It's my pleasure today to be joined by Dr. Nabe-Nielsen, who's one of the authors of a recent publication entitled The Acute Effect of Night Work-Related Circadian Misalignment on Headache Episodes, Results from the 1001 Nights Cohort. Welcome. I'm so happy to be speaking with you about this work.
Thank you very much for the invite.
So first of all, can you tell me a little bit about the background? What inspired you and your colleagues to do this study?
Well, what inspired me was, and my colleagues also, was that we know, and your audience also know, that headache disorders are very prevalent neurological disorders, which have a major impact on disability and a major impact on public health. And we simply don't think that there is not enough attention directed at headache disorders and potential occupational risk factors. So that was kind of where we started. And also we have done research within the area of night shift and other occupational risk factors for many years. So we know that night work causes poor sleep, irregular eating patterns, and changes perhaps in pain perception. So there might be a link between working night shifts and headache episodes. And what we also know is that prior studies usually compare groups. So they compare, for instance, day workers with night workers. And that also encompasses some problems because you compare two different groups. And they may differ in other respects than only whether they work night shifts or not. So we thought that there was a need for a study where we compared the same individual when that individual worked a night shift and when that individual worked a day shift. And that was kind of inspired us to go on and see what we would find when we investigated this topic.
Well, I think that's really interesting and poses some very fascinating questions that often come up in clinical practice. Tell me a little bit about your study itself and what you found.
What we did was that we used data, as you already mentioned, from the 1001 Nights cohort, which is a cohort that consists of more than 1,000 female hospital employees. So we have collected these data during a 2-year period where we went out to the hospitals and met all these people and collected data. And what we did was that we, apart from distributing a background questionnaire to all of them, we also followed them for 14 days in sleep diaries. So every morning we sent by email a diary to them that they had to fill in electronically. And in these diaries, they were asked about their working hours, the previous day, how they slept, work-related stressors, and also whether they had a headache during the previous day. So these were our data, and we then selected a sample of 500 female participants who contributed with at least one measurement day with a night shift and at least one measurement day with a day shift. So we ended up with more than 3,000 measurement days from these individuals.
Perfect. So they served as their own control in that sense.
Yes, exactly. Yeah. They served as their own control. So that means that we could compare the same individuals under different conditions. And we could also take other factors into account, for instance, sleep duration and sleep quality. So we wanted to kind of disentangle what would be the effect of the night shift itself, so to speak, and what could be explained by other factors. And sleep could obviously be one of the reasons that would link night work with headache episodes. So we had all these data, and then we did our analysis where we compared the same individuals during measurement days with night shift with measurement days with day shifts. And that revealed that more or less, regardless of what we did, regardless of which variables we put into the model, we found an approximately 30% higher prevalence of headache on measurement days with night shift compared with measurement days with day shift. So that was our main finding from the study.
Understood. So were you surprised by any of this?
Well, actually, our hypothesis was that night shift is related to or would lead to a higher prevalence of headache. So that was actually not a surprise. We still felt that it was possible to document that empirically, because we don't think that there until now has been sufficient evidence for this, that it actually is not only a matter of comparing different groups, but actually occur in the same individual. That is one important thing about our study, that people with headache can now actually come with the evidence showing that what they perhaps feel is their personal story, that we can actually document that. And what actually surprised me was that there was not really a strong effect of adjusting for sleep, and there was not any effect of adjusting for other work-related stresses, which is also assumed to be a possible risk factor for headache. So even though we adjusted for these factors, the association remained the same. So in a way, they didn't surprise me, but I was surprised about some of the sub-findings, though. Yeah.
Yeah, I think that's really interesting that it is that night shift that impacted these individuals the most, and that is some data that they can use as they make some decisions for themselves about what might be a better work environment for them, if that is a possibility. Although, as we know, for some individuals, they don't have that option, right? So some people have to engage in night shift and so on. So for those individuals, do you have any suggestions? For people that might not have the option if they have migraine and they have to engage in night work or shift work, what are things that we might be able to do or their employer might be able to do to make it a more conducive environment from a migraine perspective?
Well, first of all, it's important for me to stress that our study does not document any effective preventative measures, because that was not what we investigated. We started by investigating whether there was an association in the same individual and the influence of some specific factors. And since we did not find that, for instance, taking sleep into account remarkably reduced the association, then we cannot, for instance, recommend sleeping a better sleep hygiene, for instance, as a preventive measures. So at this point, I think what our findings can be used for, and what I hope they will be used for, is to draw the attention to this problem and maybe serve as a starting point for a person, an employee who works night shift in many occupations where we know that it's necessary and it's important for society that people will engage in night work, that they would use our findings to have a discussion with their employer, for instance, regarding some personalized work scheduling, or to have a discussion with the DP about optimal pharmaceutical treatment or other non-pharmaceutical treatment or preventive measures that could be taken. So it's more a question about seeing this a step forward in order to seek counseling and advice for people and for practitioners, for experts, to take this problem serious. And then I, of course, hope to have the possibility to dive more into possible preventive measures, for instance, how you nap before or during the night shift, etc.
I think that's incredibly helpful. Do you have any other comments or thoughts to share with our audience?
Well, I think I will only repeat myself, and I hope that the public attention from politicians will increase with our study, and also with the interview that we are doing here. That actually that people will become the general knowledge about headache, and that it's not something that you have to deal with yourself, but it's actually a burden to public health with a major impact on disability. And I hope that also this will lead to more attention to other occupational risk factors in order to adapt, obviously, to people, the working environment, to people who suffer from headache, but obviously a general acknowledgement of how you could accommodate the working environment to those people who are at work. Yeah.
Well, thank you so much. We really appreciate your research and your advocacy. Thank you so much for taking the time to speak with me today.
It was a pleasure. Thank you.